Most people who move to Ireland end up paying for healthcare they were actually entitled to get for free. Not because the system doesn't support them, but because nobody told them what to apply for, or when. By the end of this video, that will not be you. We're going to go through everything: GPs, the medical card, the GP visit card, payment schemes, and hospital charges. And I'll tell you, at each step, exactly who qualifies and what to do. But stick around to the end, because the scheme I'm going to cover last is the one most new arrivals completely overlook, and it could save you hundreds of euros a year on prescription costs alone. Right. Let's start from day one. Picture this. You've just landed in Ireland. You've got your bags, you've got a place to stay, and within 2 weeks, you wake up feeling terrible. You need a doctor. If you haven't registered with the GP yet, that moment becomes a crisis. So here's what you do the moment you have an Irish address. You start calling GP practices in your area and asking if they're accepting new patients. That's it. That's step one. Now, fair warning, especially if you're in Dublin, this can take time. Many practices have closed lists. It's completely normal to ring 5, 8, even 10 GP surgeries before you find one that says yes. Start early. Don't wait until you're unwell. Once you're registered, a standard GP visit will cost you between 50 and 80 euros. But here's the thing. You may not have to pay that at all euro. The medical card is Ireland's most powerful healthcare entitlement. Many new arrivals mistakenly assume they won't qualify and don't apply. That's a costly mistake. A medical card gets you free GP visits, prescribed medicines, and public hospital care. Dental, optical, and maternity services are also covered. So who qualifies? First, you must be ordinarily resident in Ireland, meaning you live here and intend to stay for at least 1 year. Second is income. The HSE does a means test on your take-home pay. For a single person, the weekly net income limit is roughly 184 euros after allowable expenses. Thresholds are higher for couples and children. Some people skip the means test entirely. If you're over 70, you qualify automatically. If you've arrived from Ukraine under the Temporary Protection Directive or are an asylum seeker, you're entitled to a card immediately. Certain EU citizens can also apply directly. Apply online at mymedicalcard.ie. It's the fastest route to track your application. Didn't qualify for the medical card? Don't move on just yet, because there's a step below it that's wider and easier to get. The GP visit card covers free GP visits only. It doesn't cover prescriptions or hospital stays, but free GP access is still worth a lot when you're new to a country and finding your feet. The income thresholds for this card are noticeably higher than the medical card. In fact, since 2023, the scheme was extended so that households earning up to roughly the median Irish income can now qualify. And some groups get it with no income test at all. All children under 8 are automatically entitled to one. Everyone aged 70 and over qualifies automatically. And if you're receiving carer's allowance or carer's benefit, you're entitled without a means test too. Same application, same website, mymedicalcard.euro. Right. This is the scheme I mentioned at the start. The one most new arrival don't know about, and the one that can make a real difference to your monthly costs. It's called the Drugs Payment Scheme, and here's why it matters. Under this scheme, no individual or family pays more than Euro 80 in any calendar month for approved prescribed medicines. Once you hit that limit, the rest of your medication is free for the rest of that month. Every month. That's the deal. And here is the part that surprises people most. There is no means test. It doesn't matter what you earn. As long as you are ordinarily resident in Ireland, meaning you live here and plan to stay at least a year, you qualify. It covers you as an individual, or as a family unit. Your partner, children under 18, and full-time students up to the age of 23 can all be included on one registration. Since June 2025, it also covers free hormone replacement therapy for anyone prescribed it. If you're managing a long-term condition, there's one more scheme that could change things for you significantly. The long-term illness scheme. Under this scheme, if you have one of a specific list of diagnosed conditions, your medication for that condition is completely free. No monthly cap, no prescription charge, nothing. The qualifying conditions include diabetes, epilepsy, multiple sclerosis, cystic fibrosis, cerebral palsy, acute leukemia, and several others. Again, no means test. You just need to be ordinarily resident in Ireland and have a confirmed diagnosis. Quick word on hospitals, because this is where people often get caught off guard. If you walk into an accident and emergency department without a GP referral, you'll be charged Euro 100. That charge disappears completely if your GP refers you, so always call your GP first if you can. Minor injury units. Great for sprains, minor fractures and cuts. Charge is 75 euros. Again, waived with a GP referral or medical card. And if you're an EU citizen, bring your EHEC card from your home country. It covers emergency treatment across Ireland and the EU. But what happens if you get ill when your GP is unavailable? Don't panic. Out-of-hours GP services are always there to cover in evenings, nights, weekends, and bank holidays. They are for urgent but not life-threatening problems like fever, ear pain, vomiting, and minor infections. You must call first. A nurse or doctor will advise you and may ask you to come in. Find your local service through out-of-hours GP. So here's your actual action plan. 5 steps in order. 1. Get an Irish address, then immediately start calling GP practices. 2. Apply for a medical card or GP visit card at mymedicalcard.ie. Even if you're unsure, let the HSE decide. 3. Register for the drugs payment scheme at mydps.ie. No means test. Everyone qualifies. Takes minutes. 4. If you have a long-term condition, ask your GP about the long-term illness scheme. 5. Keep your EHIC card handy if you have one. Ireland's health system has more support in it than most people realise. You just need to know where to look, and now you do. If this helped you, the single best thing you can do is share it with someone who's just arrived in Ireland. It might save them a lot of money. Subscribe and follow for more practical guides, and I'll see you in the next one.